Yeah, all right. Well, here to help us unpack the many mixed messages we've been getting, we have Dr. Almaz Dessie. She's a pediatric emergency medicine physician at Columbia University Irvin Medical Center in New York. Dr. Dessie, first, let me just say welcome to BNC Live. And second, how are you doing? You're in the middle of New York City's Omicron explosion, the Big Apple at the center of virus explosions yet again. What are you noticing there?
Well, first, thank you so much for having me on the show today. It's really a privilege to be here. Um, in New York, it's a little bit of deja vu for a lot of us who've been working through this pandemic continuously for the last year and a half. Um, Many of us thought we would not be here again with so many cases and so many hospitalizations and surging capacity at our hospitals overall. It's been really challenging through work. We still are worried about contracting COVID ourselves. Thankfully, we are able to maintain, for the most part, a good supply of PPE to protect ourselves. And overall, because of vaccines, we're seeing far less severe disease, excuse me, than we saw a year ago, even 9 months ago. So that part is a little bit reassuring, but unfortunately, just the case numbers are rising so quickly compared to 2 weeks ago. My shifts to today, 2 to 3 weeks ago, very few positive tests in my patients. Now, the majority of patients are testing positive for COVID. It's really disheartening.
Yeah, I mean, at one point, New York was in the clear, along with a majority part of the country. So how have you been handling this new surge?
We are doing our best to get ready for what's coming up next. So I think we've had a problem throughout the pandemic of not being able to anticipate our next steps and underestimating how severe each surge could be. So right now we are bumping up staffing as much as we can, trying to make up for staffing of people who are out because they themselves have contracted COVID. We have a lot of staff shortages, as was mentioned by Dr. Phillips earlier in the show. So that is really challenging for us. So we're trying to just keep our hospital staffed. We're trying to figure out ways to get testing easier and faster for our patients, trying to redirect patients to testing resources throughout our city, and just generally around the area. So those are kind of the steps we're taking right now.
Yeah, the new guidance from the CDC, cutting isolation and quarantine time down in half. What are your thoughts on that? Do you support that decision?
We have yet to see. It's hard to support without the true data behind that decision that has yet to be published by the CDC. Overall, it is true with prior variants that the majority of transmission happens early in the course, the day or two before you feel sick, and the first few days that you're feeling sick. But we haven't seen that exact data replicated with Omicron, so I am a bit hesitant to see people go back to work after only 5 days of illness. A reminder that if people are still ill, they still have fevers, are not getting better, they should not be going back to work at 5 days. The last thing we want, particularly as healthcare workers or anybody else who's really interfacing with a lot of people, we got to keep the people we work with safe. And for me, I have to keep my patients safe, and that is my number one priority. If I get sick with COVID, if there's any chance that I could transmit that to a patient by coming back to work too early, that's a non-starter. So that needs to be, monitored very carefully. We need to see if this strategy is effective. Unfortunately, the reality is so many people are getting sick. Hospitals and other industries are understaffed, and there is a push to bring people back to work early just to keep our economy, our hospitals functioning. But I am a little bit concerned about what that means in terms of overall spread.
Yeah. What about hospital bed capacity? Where does your hospital fall within that realm right now?
We are pretty high, close to full capacity, but not
Wow.
quite there yet. It fluctuates from day to day. We're not at the point where we're canceling all our surgeries like we did maybe a year and a year and a half ago with other surges we've seen, but we are close, and we need to be careful. For me in particular, I work with children, and right now is peak respiratory virus season for children, not just COVID, but the flu, viruses like RSV that put kids in the hospital every winter at high rates. So that coupled with COVID really puts us near capacity, and it's very stressful and challenging for the providers, for the families, for the kids to figure out where everyone's going to go.
Yeah, I can hear the concern in your voice. Let's talk about kids. Are you noticing an uptick in cases? Because around the country, COVID cases in kids is surging at this time.
We are. The headlines in the news are correct that overall the caseload in children is increasing rapidly, exponentially. It's higher than it's been in the past with other surges. And part of that is probably because fewer kids are vaccinated than adults. And as a result, we're also seeing more children admitted to the hospital in New York and overall in the country. But that is probably um, proportional to the number of cases we're seeing. So if only a small percentage of children are admitted to the hospital with COVID, when there's a much higher rate of cases, 10 times increase, 4 times increase, you're going to see 4 times increase in the number of hospitalizations. So I'm reassured that overall children tend to do well. The risk of hospitalization is quite low, and the risk of severe disease in the ICU is incredibly low. That's a really rare outcome. However, we need to protect our kids, and the ones who are able to get vaccinated need to get vaccinated.
Doctor, are we talking about seeing a surge of kids under 5, or are we talking about kids who are actually eligible for the vaccine?
We've seen both age groups. I mean, all age groups of children under 18 being admitted to the hospital. Overall, again, rates are low. What we've seen is in that 5 to 11 age group in New York State, at least, as the reports from last week show that every child who was hospitalized was not vaccinated. And the older kids, those teenage, 75% of those who were hospitalized in the last couple of weeks were not vaccinated. So 5 and up, they have the opportunity to get vaccinated. They need to get vaccinated. We're seeing fewer hospitalizations in less than 5 years old, despite the fact that they are not able to get vaccinated yet. But the best thing parents can do really is try to protect all kids. If your kid's eligible, get them vaccinated. We have a few days till school starts, and they can get vaccinated.
Yeah, Dr. Dessie, I mean, any child being ill is concerning. But I want to ask you, are you noticing more Black and brown children? Just for the simple fact, and the reason I'm asking you this is because our vaccination rates lag behind other groups.
That is a great question. I'm glad you asked that. I can't speak specifically to the exact numbers of that because that has not been kind of reported yet. Overall, because the cases are so low, it's hard to say if it's specifically Black or brown kids. That lag in vaccination is getting smaller and smaller. I'm happy to appear on this show to encourage vaccination to kind of help with that as well. I work in Washington Heights. I take care of a lot of brown kids. I take care of a diverse population, and a lot of kids are coming in testing positive. Thankfully, very few are ending up in the hospital. But what we've seen in the prior trends in the last year and a half is Black and brown kids are disproportionately being admitted to the hospital. And that reflects the higher rate of disease in their communities due to all the structural racism and other access to care issues. So what we need is to really focus vaccination efforts on those communities that are underserved and deserve better care and need the vaccination.
Yeah, absolutely. I just have one more question for you. The mayor of New York recently spoke about children being safe in schools. When school starts back, they're safer in within schools. Do you agree with that, considering the surge?
I'm happy you asked that question. I do agree with that. I can speak about New York City and New York State specifically, where we have a pretty high rate of vaccination compared to nationally. The number of folks who are eligible for vaccine and vaccinated in the adult population is quite high. Among kids, it's lower than we want it to be, but we need kids in schools. And that question about disparities among Black and brown kids, among wealthy kids versus poor kids, all of those disparities play out in different ways when kids are out of school. So the education gap among Black and brown kids versus white kids, that is exacerbated by kids being out of school. Remote school does not work well for certain communities who do not have access to internet. Other things like keeping kids away from crime, getting kids food. A lot of kids rely on school to be fed. There's so many aspects of health, wellness, education, mental health, child safety that are provided through schools. And the overall risk to any individual child of getting really sick with COVID and ending up in the hospital is extremely low versus the risk to children of not getting those services and not getting the education they need. That is a risk that I don't think we should tolerate. So I think schools need to stay open. I agree with the mayor on this one. I mean, we will see, but I agree with the mayor on this one.
Yeah, Dr. Dessie, very insightful conversation. It was a pleasure having you. Thank you for carving the time out to
Thank
talk
you
with
so much.
us. And Happy New Year.
Of course.
For many Black women, our hair, it's our crown, right? So how do we deal with hair loss? Let's talk about that, right? Jada Pinkett Smith, she opens up about